Hello and welcome to this webinar on cash transfers for COVID-19 relief. I'm delighted to welcome you today on behalf of the Center for Effective Global Action, CEGA, and Innovations for Poverty Action. So just by way of background, Innovations for Poverty Action, IPA, is an organization dedicated to discovering and promoting what works to reduce poverty. While our roots are firmly based in impact evaluation and the use of randomized controlled trials, we've been expanding that focus in recent years to enable us to be more increasingly policy and practitioner responsive. This expansion into use of other rigorous methods has been amplified through the COVID response, and we're very grateful to our partners and collaborators who have enabled us to really push for more use of data and evidence in both designing and implementing evidence-based solutions. I encourage you to look, if you haven't been able to, at the RECOVR hub, which is a consolidation of a number of partners' contributions of data and evidence. Over 140 studies, I think, right now, and perhaps 30 or 40 of those with results that can be shared to really amplify issues and diagnoses around different aspects of COVID, related to COVID. So today's panelists, I'm very excited to welcome our esteemed panelists today. We have Josh Blumenstock, who's assistant professor at UC Berkeley, is an assistant professor at the UC Berkeley School of Information, the director of the Data Intensive Development Lab, and faculty co-director of the Center for Effective Global Action, our co-host for today. His research lies at the intersection of machine learning and empirical economics, and he focuses on using novel data and methods to better understand the causes and consequences of global poverty. I'm also delighted to welcome Minister Cina Lawson, who is the Minister of Post, Digital Economy and Technological Innovation for the Government of Togo, a position that she's held since 2013. During her tenure, Minister Lawson has dedicated her service to promoting the use of ICT to support prosperity for all citizens of Togo through a wide range of initiatives, including, but not exhaustively, digitizing government, expanding the focus on digital financial inclusion, education, agriculture, and even most recently, cybersecurity. We're grateful for her time and presence on the panel today. I'm also very happy to also welcome from the government of Togo, Monsieur Shegun Bakari, who's the senior advisor to the president of Togo and advises the president on a range of issues, particularly on poverty reduction strategies, private sector investments, and renewable energy. He's a staunch proponent of the NOVISSI program, which we'll hear about today, and has played a significant role in its development. Laichena is Africa Operations Director, for GiveDirectly, where he's worked since 2017. In this capacity, Mark oversees GiveDirectly's operations in Kenya, Uganda, Malawi, Rwanda, Morocco, and Liberia. And the Africa response for GiveDirectly, the COVID Africa response, has very impressively reached around 123,000 people to date, with a goal of reaching 450,000 people in total. And lastly, but not least, is I'm delighted to welcome Tina George, who's the Senior Public Sector Specialist at the World Bank Social Protection and Jobs Practice. She's leading the bank's regional engagement with Togo and 5 other West African countries to build the foundational elements of delivery systems for social protection. And lastly, just to introduce myself, I'm Radha Rajkotia. I'm the Chief Research and Policy Officer at Innovations for Poverty Action. So just as we launch into the webinar, a key question as we're thinking about how to best target cash transfers is really just thinking about why we're using cash transfers as part of this response. What does the evidence tell us about the use of cash transfers? So we know that since March 2020, there's been a somewhat of an explosion in the use of cash transfer programs. Hugo Gentilini and team's analysis, excellent analysis, which I would also recommend taking a look at if you have not already. The latest data suggests that there are now 298 cash transfer programs across 153 countries that are either planned or in place for COVID response. And the use of cash transfers is by no means new, but it has been shown, and part of this is due to the positive effects that it's shown to have, from a wide-ranging number of outcomes, from improving food security, asset ownership, savings, physical and mental health, school attendance, intra-household dynamics, and then also the multiplier effects that exist for local economies. Importantly, and this is often a question, it's been shown that recipients rarely spend transfers on temptation or vice goods and activities. And significantly, and I think this will be part of the discussion today, is the importance of context and how important how important context is in determining when cash can be most effective. And evidence has also suggested that that's the case when local markets are well functioning and security permits. So with that, I will hand over to our panelists. We will be, in terms of structure for today, we'll have short contributions from each of our panelists, and then we will be saving about 20 minutes for the end for Q&A. You participants should feel welcome to include questions in the chat, and our panelists will be answering those live through the chat, and it will also be consolidating some of those key questions for the Q&A at the end. So with that, Josh, I'll hand over to you. We can't hear you, Josh. I think you're still on mute.
Can you hear me now and see my screen?
Yep, perfect. Thank you.
Great. All right. Thank you, Radha, for the introduction, and of course to everyone for joining. I thought I'd spend the 7 or 8 minutes in front of me talking about this question of targeting cash transfers. In other words, determining whom should be prioritized for aid. But just to provide a little bit of context, I think, for all of the speakers today, I think if you're tuning into this webinar, you're probably familiar with it, but the numbers are quite striking of just the magnitude and severity of the humanitarian crisis affecting developing countries. So these estimates from the World Food Program suggest that over 250 million people will be suffering from acute hunger by the end of the year. And what's going on is that it's not just the pandemic itself, but it's the economic consequences, in particular, when governments lock down the economy to stop the spread of the virus. This removes many households' primary means of subsistence, and then hunger sets in. And to make this a little bit more personal, and also to provide additional context for some of the speakers who follow from Togo, I'm showing you here some data we collected just a few weeks ago through a survey that was done in partnership with the government of Togo as well as the World Bank, where over the course of about a week and a half, we surveyed 15,000 Togolese citizens over the phone. And you can see of those we surveyed, more than half report that they have to skip meals on at least 1 day per week. And then 1 in 5 individuals that we surveyed in Togo report having to skip meals every day. So this is very real and very recent consequences of the virus and the shutdown. And so in response to this humanitarian crisis, governments all over the world are mobilizing relief efforts. And Radha just touched on just the magnitude of how many relief efforts there are. Unfortunately, in most cases, governments just don't have enough resources to do something like universal basic income and provide something to everyone. And so that really raises the key question that I want to address, which is how to think about identifying the individuals with the greatest need, individuals, the households, the families. And of course, the reason this is a challenge is because in many developing countries, a lot of work is informal, people aren't filing taxes regularly, and oftentimes government registries and social protection registries are out of date and often don't necessarily capture the new poor, right? They may track the poorest of the poor, but in the context of coronavirus, there's a lot of people who were sort of above subsistence before, but have fallen below once their primary source of income has been removed. And of course, there's no way of collecting this sort of data at a country level in the middle of a pandemic when you're trying to minimize face-to-face contact. So, you know, the question we're asking ourselves is, how should we think about targeting cash transfers in response to something like coronavirus in this sort of challenging environment? And I think that the status quo is that a lot of the existing data sources that social protection programs would normally rely on are either out of date or incomplete, and of course, very difficult to update in the current environment. So what I'm going to focus on for the next few minutes is just a couple slides each, or maybe even one slide each, on some new approaches that are leveraging non-traditional data, as well as techniques from computer science and machine learning, sort of the technology driving the Googles and Amazons and Facebooks of the world, to think about how that same technology could be repurposed to better target cash transfers. So the first one, which I'll call the satellite-based approach, is really just a stand-in for thinking about how you can do very precise geographic targeting using non-traditional data. And the central insight here is that when you look at high-resolution satellite imagery, and here are a sample of images, you can just go to Google Maps and download these, that illustrate that it's very visible in the overhead imagery what the rough quality of life or rough socioeconomic status is of the households captured in the image. You know, wealthier households have different roofing material, the roads are of different quality, the farm plots are different size, different housing density. And the idea is that machine learning technologies, which at their core are really just technologies for pattern recognition, can pick up these patterns and use them to construct incredibly high resolution poverty maps. So this is an example from a collaboration with the government of Nigeria and the World Bank that is showing you 1 kilometer grid cell estimates of the distribution of poverty in Nigeria. And what's going on here is we start with some ground truth, you know, the typical government household survey data. But instead of doing what the national statistical agencies are really good at, which is producing administrative level aggregates of the estimate of wealth or poverty, we can build these very high resolution maps by using the satellite imagery to interpolate between locations that are surveyed. So you can see in the prior slide how satellite data can be used to identify, say, villages or neighborhoods or even households that a government might want to prioritize for humanitarian response. But this, of course, leaves open the question of how to identify individuals and households that are actually going to get this transfer. And this is something that some of the speakers after me will talk about. I'll just highlight one approach that is being tested in a few countries, including Uganda, which is the idea that the mobile phone operators often have the most up-to-date and accurate location information on subscribers in the country. So for instance, what GiveDirectly is doing in Uganda is after certain regions have been prioritized, say by the government or by a humanitarian aid agency to receive benefits, well, they work with a phone company to send messages to the people who live in those areas, where the phone company knows this based on how people are using their cell phones, their mobile phones, and then that message provides information to the potentially eligible beneficiaries about what steps they should take if they want to enroll in the program. Now, why phone data? I mean, I think the point is, if the government has comprehensive population data on where people live, then they should absolutely use it. But in a lot of cases, it's the private sector's registries that are most accurate and up to date. I'll just briefly highlight one other use case, which we're piloting right now in a few different countries, which is the idea that oftentimes after prioritizing a neighborhood or a village for aid, the government may still not have enough resources to do universal coverage. In other words, to blanket provide benefits to everyone in the region. And here we're seeing novel approaches that are also leveraging additional data from the mobile phone or mobile money operators, or occasionally from other financial institutions, that show how that data can provide an indication of which individuals within a village or within a neighborhood might be prioritized for support. And one partner that we work with is using airtime balance. And so the idea is that people who have average airtime balances below some critical threshold are on average much poorer than people who have it above some much higher threshold. Now, this is a very coarse rubric, but in practice, it does allow the government to separate sort of the ultra wealthy from the ultra poor. And just to give you a little bit of sense, and this I think will be my last or second to last slide, of what this looks like in Togo, and you'll be hearing from some of our partners, Minister Lawson and Mr. Bakari, who are really leading this effort in Togo. Our group is just providing some of the analytic support. This really contrasts sort of the status quo on the left with traditional data, and then what you can do with non-traditional data on the right. And what's going on here is I'm showing you, we're running simulations that say we wanted to expand the existing benefit program to additional 50,000 or 100,000 beneficiaries. Well, if we relied on the data from the government, the most recent data from the government, which comes from a 2017 pseudo census, and we were only targeting prefectures, we'd only be able to target one prefecture. If we did this at the canton level, we'd be able to reach 5 cantons until we hit that 50,000 threshold. But if we start to rely on some of these more granular, high resolution approaches, including satellite maps and mobile phone data, that allows you to sort of disaggregate and pull out, in this case, the poorest of the poor. And so one thing that we're looking forward to is doing some rigorous evaluation of these approaches over the coming months. So just to summarize, I think the key point I'm trying to make here is that new data sources can provide new options for targeting humanitarian aid. These are not meant to replace existing social protections or in any way, but what we see is that they can provide a second social safety net for people that might otherwise be excluded just because they're missing on the official register. So I think, looking forward, this raises a couple important questions. One is, can these methods actually help reduce errors of exclusion? In other words, get aid to people who would otherwise not get it? And I think the answer is almost certainly yes, as long as they're carefully integrated into existing social protection programs. But then there's a second important question, which is, are we comfortable with this shift from traditional, often community-based targeting to a more centralized, administrative, high, big data-based approach? And there are many important ethical, practical, and privacy considerations. I've highlighted a couple. Maybe during the Q&A we can talk, I'm a bit out of time, but about how to think about doing this in a way that respects the human rights and the privacy of the subjects whose data is being used. I think at the end of the day, it's going to boil down to the specifics of what data are we talking about, who has access, was consent provided, and so forth. But there are many other important challenges. How to think about households that don't have phones. You'll hear from Togo. I think the good news there is that roughly 90 to 95% of households have a mobile phone in the household, but in other countries that might not be the case. So with that, let me just leave off. I'll just sort of highlight this last point, that I think the technology creates powerful options, but at the end of the day, it really is just one link in this longer chain of humanitarian aid. And I think one thing that you'll hear from Minister Lawson that Togo has done really well is think about how to integrate new technology in a way that preserves transparency and also really builds in human support and triage and interaction, so that really makes the most of the technology rather than just replacing existing programs with a new one. So I'll leave it there. Thank you.
Wonderful, thank you. Let's hand it over now to Minister Lawson and Monsieur Bakari.
So we're very happy to be here today. It's an honor for us to present the NOVISSI program that we've implemented in Togo, which is a cash transfer program designed to help the poorest during these difficult times. So to give you a bit of a background, the first COVID case we had in Togo was in March 6th. And 3 weeks later, in April 1st, the president and the parliament took the decision to implement a state of health emergency. And so what it meant was that we were going to implement social distancing measures, such as curfews, restrictions of movement. We closed stores, schools, etc. So, and one major concern of ours was that, yes, we wanted to prevent the disease to spread, but we wanted to also make sure that we weren't going to increase poverty in the country, and that we could find some kind of support to the informal sector. So very clearly, the president's objective was at the time that we needed to make sure that we could come up with cash transfers to support the informal sector. And what is remarkable was that he announced the state of national emergency, a health emergency on April 1st, and a week later, we were able to launch this cash transfer program. So next slide, please. So the NOVISSI, the program was called NOVISSI, which means solidarity in local language. The one concern we have was to have a program which would respect all the physical distancing rule we were setting up, which was that from onboarding to getting the cash, we needed to make sure that everything was digital so that we would never have to actually physically meet the beneficiaries. So the NOVISSI program is 100% digital from onboarding to getting the funds. It's absolutely transparent. We're using digital, so we have real-time statistics. And one thing we did throughout the life of the program was to give daily updates of the beneficiaries, the number of beneficiaries, how much money was spent. It's fully traceable. We were able to target, to have eligible population based on people's geographic locations, occupations, and also gender. And it's a very secure system because we use voters' ID to make sure that that the people we targeted would be the people who received the funding. So the whole objective was that the capital city, Lomé, the capital city, was the most hit by the virus. So it meant for us that we were going to implement very drastic measures in Lomé. So it also meant that Lomé, the capital city, and the greater Lomé, and another prefecture, which is Chaozhou, also hit by the virus, would be the populations within these zones would be the ones getting getting the cash transfers. Next slide, please. So in terms of how much money we were able to provide individuals, it's the NOVISSI program was 1/3 of the minimum wage. So we wanted to support households. So we decided that we would give more to women than male. So women got $20 per month and men got $18 per month. And it's very important because this program of cash transfer provided 1/3 of minimum wage. And at the same time, we had other programs supporting the informal sector and the poorest with electricity costs and water costs. So what we did was that the state decided to waive utility costs, which also represented about 1/3 of their expenditures. Next slide, please. So over the course of 2 months, we spent approximately $20 million, and we had 1.3 million Togolese registering to the program, and out of which we had 567,000 beneficiaries. So 1.3 million registration meant that 1/3 of all adult population in Togo registered to the program. And to be eligible to receive funding, you needed to be in Lomé, in the greater Lomé and Chaozhou, and also you needed your occupation to be, you needed to be employed by the informal sector. So it's very significant what we did, because 15% of all adult population of Togo did receive funding and help during that time. Next slide, please. So what did we learn? Number one, we learned that because we wanted to make sure that the money that we spent reach the poorest of the population. So what it also means for us is that we had to use voters' ID, and we were lucky enough because we had presidential elections in February this year. So we had up-to-date biometric database. But what it also means for us looking at the future is that we need to make sure that we deploy biometric ID for the entire Togolese population, which we are doing because we have to we're launching a project with the World Bank to deploy biometric ID. The other thing is that the NOVISSI program showed the Togolese and the world that actually digital government to payment models work, and especially when we talk about social protection. So it's also a methodology. So it's a new methodology to transfer money to the informal sector. And the third point is that we were able to gather a lot of information, big data, and we want to be able to use this information to better refine our policies moving forward and looking at the future. And that's why we actually work with the team of the IPA to really see what we can do with this data to better target the poorest of the Togolese. Thank you very much.
Thank you very much, Minister Lawson. It's brilliant to hear what's been done in such a short time. Let's move on then. I think, Mark, we're going to move on to you. And I'm just going to give a plug to our panelists to remember to look at the Q&A and please respond to any of the specific questions that have been raised there that you're able to. Thanks so much.
I'm up. Radha, is that correct?
That's correct, Mark. Yeah. Do you want to share your
Great.
screen?
Can you see my slides?
We can. Yes, thank you.
Wonderful. Okay. So yeah. So as mentioned, my name is Mark. I work with GiveDirectly with our programs across the 7 African countries we're in. It's really exciting to be a part of this conversation. I mean, and to hear from the fellow panelists on targeting. We have been doing some similar work to the types of things that Josh has mentioned as there, and that we're excited to be having conversations also with Minister Lawson about sort of what learning areas there may be in Togo for some of the rest of the year as well. And I think our real hope is that sort of coming out of this year, there's very much sort of a set of demonstration points and real case studies that we can learn about. Given what's been said about those models a bit already, what I'm just going to talk for my time here is just a bit about more generally what the shift has looked like for a cash implementer like GiveDirectly. Draw attention to another model we've been also doing, which is working a lot more with CBO networks and where there are lists of vulnerable individuals, and also about sort of, what this has meant for some of our, where we've just had to really think about how to engage with communities along the way as well. And so for much of GiveDirectly's work, our focus has been in rural areas, often testing investment size grants, targeting households, and doing that kind of directly with our staff with boots on the ground, with sort of various evaluations, often in partnership with IPA and so on. But I think as we saw COVID happen, and we saw the types of impacts which Josh and others have been calling out here in terms of meals being skipped and job losses and all of that, we've made a big push to really pivot to shifting to emergency work in this context, and pausing some of those less time urgent less time urgent projects, though continuing paying out cash where we had done that. And I mean, I think what's been interesting about this shift for us so focusing on urban slums, where we've seen these sort of biggest impacts, and shifting to basic income size payments and so on, has also been that we've been finding different targeting mechanisms and so on, really varying based on the needs in different areas. And so in some areas that has consisted of telco approaches have been described. In other settings, working with governments where existing prioritized lists exist. So for example, in Rwanda, we've been doing that. And then in other areas, working to sort of try and quickly scale up groups of community-based organizations to sort of saturate areas using approaches like that. And I think similar to Togo, we've been working really hard to try and see how we can use technology for efficient enrollment without sort of sacrificing quality in terms of recipient experience or anti-fraud management. And so one thing in particular we've been doing has been thinking about how we can connect our model with community-based organizations who know the community so well, especially in sort of urban slums and so on, which often aren't well mapped or covered by existing government social protection programs, because the types of young people there and sort of urban informal sector workers are not necessarily the drought-prone areas or so on, or the elderly, which other programs might cover. And so for us, I mean, the big motivation as well here has been, how do we have a cash enrollment mechanism which doesn't make COVID spread worse? And one key thing we know there is that we can run robust remote processes if we can reach people in a lot of areas, given phone penetration. In some areas that's not possible, though we can certainly work on that and try and find the safest way to do that. If we can do open or public enrollment, as Togo is describing, that's obviously appealing. In other areas, the government may not want to do that. There may be risk around that. There may be concerns. And what we find is that often it's organizations in these communities who already have lists for vulnerable individuals, but don't have experience running scalable cash programs. And so to give one example, in Nairobi, what we've been doing, and we've reached sort of a bit more than 50,000 people with this so far, though continuing to scale up, has been adding on community partners where we're sort of targeting known lists to them, where they know vulnerable folks. We can find a way to invite those people directly to engage. It actually works quite well in terms of people understanding who's being reached and who's not, because they understand and respect the organizations that are being worked with. The other thing that we've been working to do, which I've been really excited about, is how we can actually do more to try and sort of localize programs through this type of work. And so, for example, how do we make sure we're building those relationships so that if you have gender-based violence challenges, or if you have other elements, you've got a sort of a ready-to-go network of folks who both can surface that and can flag that type of information. And then finally, we've been still working to say, even in environments like this, how can we work to try and sort of avoid duplication and that type of thing. Concretely, for recipients who are going through this pipeline, what this, I just kind of wanted to lay out to sort of make it a bit more concrete of what some of this has looked at. And so this has looked like, reaching out and making sure we've got the participants want to enroll in these programs as appropriate. Validating the data on recipients that we've got using whatever sources are available. Using two-way SMS, Togo have talked about the work with USSD surveys or otherwise, or phone calls if we can do that efficiently where that's a block, and in the countries where the technology isn't so readily available. Enrolling folks for cash transfers, putting in place follow-up mechanisms along the way. And then also making sure that we're doing the bits in terms of just checking about the same elements of recipient experience and quality along the way. one thing which I think that has been interesting on this journey, just to call out, which I think all of us who have done this type of work sort of, have learned about, is just recognizing that sort of we need to be flexible with programs like this to actually understand and address user experience along the way. And I think that this is something which I think all of our teams have had to really think a lot more about along the way. So I just kind of wanted to give one quite concrete, quite simple example, but sort of to concretely discuss it. One challenge we experienced at the start was that recipients who we were reaching out to via SMS to let them know about the program weren't responding. And so we were getting, about 30% of those who could be engaged in the program actually choosing to be engaged. And so we sort of had this iterative element where we sort of thought, well, what are the things we can do here? One element was, how do we actually, make sure that our messages are simple, that people can understand them? How do we make sure that we're reaching people when their phones are switched on, and when they're less likely to have them switched off, or they're less likely to have access to power or other types of things, depending on what that is. And how do we actually make sure that we're reaching people in the way that they best can be understood, and it's not just making assumptions on that. And so most of the way that we've been doing this has just been sort of A/B testing. So trying one thing, then the other, or trying in one area versus another. And then as we learn different things along the way, factoring that in. And I think just to show the types of things here, I mean, I think my experience with a lot of the cash programming is that, people will say, well, X is not possible. Mobile money can't work because vendors won't respond, or, SMS can't work because people won't respond to SMS. I think what we have seen is that, if you do take, the approaches of patience and engaging with recipient feedback along the way, you can really find that you get sort of dramatically more uptake and engagement from folks along the way. So yeah, so I'll pause it there, and certainly happy to answer more questions in the Q&A.
Great, thanks so much, Mark. So now we'll zoom out a little bit, and we'll hand over to Tina, who will be able to talk us through some of the lessons learned from these approaches at a more global level. So thanks, Tina.
Thanks, Radha, and it's a pleasure to be part of this illustrious panel, so thank you for the invitation. So what I'm going to do is quickly zoom out and talk very briefly about the delivery systems framework for social protection, some of the foundational tech and data platforms for shock responsive social protection programs, and then focus more on lessons on the go and looking at Togo and a lot of the perspectives that have been said here already. So, okay, so just in terms of context setting, if we think about it, cash transfers, social assistance programs, labor, social insurance. So there are many kinds of social protection programs that are typically offered by governments, and virtually all social protection programs pass through similar implementation phases along the delivery chain. And this is a visual from our upcoming source book on social protection delivery systems that I'll talk to you about very quickly. So if you think about the Togo or even GiveDirectly, there's some form of outreach and taking registration and assessment of needs and conditions, eligibility and enrollment decisions, determination of the package, notification on boarding, and then that provision of either the payment or a service. And then there's that ongoing management of beneficiary operations management, if you will, and you see how this whole tapered section of where you go from the intended population to the enrolled beneficiaries. And so the reason why I'm showing you this is because this framework of the delivery chain, in our analysis, we've seen that the delivery chain is common to virtually a lot of these social assistance programs, and typically social assistance programs tend to be fragmented, and so there are opportunities really to build platforms, if you will. Foundational technology and data platforms are really helping countries build shock responsive social protection systems, and they're enabling countries to respond really quickly in times of a shock, such as the COVID-19 response. And you can see that on the left, we see 3 key platforms, which is foundational unique IDs. That is, when everyone, regardless of legal, economic, or social status, has a government-recognized zero-cost proof of identity, then social registries could potentially reach universal coverage, not just the bottom poor, and reliably assess eligibility for social assistance, labor, health, pro bono legal services. So applications that go beyond social protection, if you will. And third, social protection payments. So not just government to person payments, but person to government payments. So contributions as well, flexible contributions and withdrawals. And that makes social protection payments possible to transfer benefits as well as to enable contributions for short-term insurance or long-term savings, and contribute to digital financial inclusion and empower women. And all of this wrapped around with 3 things on the data side, which is analytics, some of the frontier pieces that Josh and Minister Lawson were talking about, and then protection, which is protecting the data privacy of the poorest, which is really important, and inclusion, which is thinking about people as the first mile and not as the last mile. You know, the whole last mile terminology comes from infrastructure, where you have to reach the last mile household, but we're saying, let's turn it around on a head and say, it's the first mile that really we need to be thinking about. And so these platforms intermediate between individuals, families, households, and various benefits and services. So now with that framing in mind, let's go to a few lessons that we are seeing from the COVID-19 crisis response in Africa specifically. Number 1 is expanding the social registry platform coverage to the informal poor or the missing middle. Number 2 is utilizing new technologies and data sources, as we just saw, utilizing mobile money payments and virtual service delivery, which we will see a lot more of, we believe, in the future in terms of health, for instance, and reducing face-to-face interactions. And 4th, in terms of expanding access to universal, zero-cost, foundational, unique identity that minimizes exclusions and enables dynamic inclusion and social registries. Okay, and that also does mobile money payments and service delivery. It's useful for a whole range of pieces. Okay, so I'm going to focus on these next 4 slides, which is what do we mean by expanding social registry platform coverage to the informal poor and non-poor. So if you look at the graph on the right side, what we're talking about is and Josh referred to this, social registries typically cover the bottom poor currently for many safety net programs in Africa, and some of our data shows that the coverage is still quite low in Africa. And if we think about it, the horizontal expansion would mean going to those who are not in receipt of regular benefits but are affected by the shock. And you'll see the typology of households in the African context below. So this comes from colleagues Melis Guven and others within the practice, and where they talk about the informal poor, which are typically part of existing social assistance programs for the poor. And then we'll go into the informal non-poor vulnerable, who have some precautionary savings to last a few weeks, and then the informal non-poor non-vulnerable, who have precautionary savings plus some long-term savings and going out to the formal sector. And if we think about it, the missing middle is who we really haven't addressed in terms of the delivery of those programs, and who we are missing from the social registries. And so that horizontal expansion to cover the missing middle is something that we are seeing many countries try to do. And one of the fundamental pieces for that is expansion of universal, zero-cost, interoperable, foundational, unique identities. And 4, verification of unique identity for the social registries. And of course, you might need household IDs to link to individuals as well. And then to deduplicate individuals, are you truly who you say you are, or are you a duplicate person? And to be a fil rouge, or the red thread that enables interoperability to link various administrative data sets. Okay, so second lesson on utilizing new technologies and data sets. And over here we see, and there's some grayed out bits here. So you see administrative information systems and the whole big data piece. So number 1 is, how do you expand? So in order to expand those social registries, how do you expand using existing data? And one is you pull together data using data sharing agreements with other whole of government entities, and you do cross checks with administrative systems across government so that you can intake beneficiaries into the the current program, and we are seeing a couple of countries trying to make inroads into that, and which is Liberia, Burkina. The second is, how do we reach people who are not in your existing programs or databases? Because the first would assume that they're in your existing programs or databases. And here we see the on-demand approach, which is also leading us to these dynamic social registries. So far, many of the approaches that we see, for example, if you look at Indonesia, they've done the census survey sweeps every 2 to 5 years, which costs a lot of money and tries to address the bottom 40%. And so that dynamic inclusion, the perspective of dynamic inclusion is lost because you're doing these static survey sweeps. So NOVISSI and Togo are really showing within this microcosm of the shock, that is, how can you intake new registrants through an on-demand feature and therefore build dynamic social registries. And third is on assessing potential eligibility and targeting accuracy. And this is where we talk about the predictive models to identify the high priority clusters, and where we see Togo, Nigeria, Niger, Guinea, Zimbabwe, a whole host of countries trying to do this, and to supplement it with mobile push questionnaires, mobile phone data, call detail records, satellite imagery, machine learning algorithms, and so forth. So there are a whole range of responses here in terms of that horizontal expansion, if you will. And then that brings me to the third point, which is on scaling mobile money payments to reduce face-to-face interactions. And one of the, again, these are all sort of models and visuals from the source book, which I will talk to you about in the end. So number one is we see for the single program to single provider model, let's say it's one program and you have one provider set up, you see that there's some sort of staggering of payments at physical sites because they're simply not able to go to electronic payments. And so they do need to think through how to reduce crowds, change payment frequencies from monthly to quarterly, and some examples being Angola, Sierra Leone. The second, in terms of shifting to mobile money or e-voucher accounts, and although these transfers are made virtually, they are closed-loop transactions, and they have to be cashed out at some point, but then you need guidelines for physical cash out, and you'll see in Togo's case where they were actively encouraging people not to go and crowd around and cash out. And then third, in terms of another piece that we're seeing is provision of virtual transfers deposited in mobile money or bank accounts, and these could be choice-based, that is, you give them the choice of provider and also the know your customer waivers, and we're seeing these in some of the development policy operations and policy reforms in Cameroon, Guinea, and the DRC. But let's bear in mind that the regulations may not fully permit digital transactions.
So Tina, lastly, sorry to rush you. Might need to rush you in 30 seconds through this last slide so that then we can move to Q&A with our
I'm done.
Thank you. Do you want to have
all right.
Look through this slide?
No, I'm done. I'm done. I'll just do the last slide and I'll okay. Okay. So expanding access to universal foundational zero-cost unique identity, as I said, and I won't dwell on this slide because we talked about that in the context of the social registry already, how important it is to have a foundational ID platform that's inclusive of everyone. Because if we don't have, so there is a difference between identification and eligibility assessment. They are not the same thing, and they're not proxies for each other. Identification is only you are who you say you are. It has nothing to do with are you eligible or not. And the assessment of eligibility is a separate process that happens through the social registry. So these are two separate processes that need to be laid out. And lastly, we will be putting out a source book on social protection delivery systems at the end of this month, and that will have some of the details around the models and the framework, not on the COVID response, but the models on the framework. Thank you.
Wonderful. Thank you so much, Tina, and apologies for rushing you through those slides, but clearly lots to cover. So with our last 10 minutes, maybe what we'll do, I've been looking at the Q&A and it's been very active. So maybe what I'll do is I'll just give each of you a question that seems to have come out from the Q&A. And then we can use the last 10 minutes to respond. So maybe starting with Minister Lawson and Monsieur Bakari, there's been a lot of questions around concerns around data privacy and confidentiality. So can you describe how you approached this in the context of Togo? And then an add-on to that is, can you also talk a little bit about some of the gender dynamics, which are quite interesting in the way that NOVISSI was both designed and implemented. So those two questions for you. So one around privacy and then the second around gender. for Josh, could you speak a little bit about other sources of data? So why mobile phone data and not tax data or employment records? What other kinds of data could you use, and what are some of the trade-offs there? For Mark, could you speak a little bit to the way that vulnerability has been defined here, and how you're capturing some populations who might be otherwise excluded? So again, women, the disabled, elderly, but also thinking about that with this new definition of poor there. And then a more general question for Tina then is that we've learned a lot now, I think, through this discussion about the mechanics of some of the delivery systems. What are we learning, and what are the lessons that we've heard around recipient perceptions and the way that they've been reflecting on and engaging with some of these different approaches? And given that we've got 8 minutes, I'll be strict, but if you can each take sort of 90 seconds to 2 minutes, and then we should get through everything. So let's start with Minister Lawson and Monsieur Bakari, please.
Thank you very much. We were very careful to respect people's privacy. So the data was, so every information that we use was anonymous. But we needed to use the data to be able to have statistics about how much money was spent, when it was spent, etc., and also to design, again, to refine our policies. So the goal, of course, is that the other thing is that with NOVISSI, we really wanted to build a new methodology for social protection. And you can't be thinking of this methodology without thinking of how important privacy is going to be. People want to be beneficiaries, they don't want their names out there. And they want to be able sometime, at some point, if they don't need it. And that's why we even wanted them to register. We didn't assume that they were poor and they should get money. We said, if you need money, please do register. But then when you register, we're very careful, and we try very hard to control who would have access to a certain set of data. So and that's very important, and it's very important for us because we wanted to make sure that, because we address the poorest, we wanted to make sure that we would be as respectful as possible with the privacy, because it's not necessarily a concern of theirs. This is more a concern of ours in terms of we, government, setting up rules for the future.
Terrific, thank you. And the question on gender.
Well, gender, unless Mr. Bakari, you want to answer the gender question? I don't know where he is.
No, I will let you. I will let you continue. I think you are doing very well.
Gender issue. It's really about understanding that most of the time in West Africa, traditionally women bring revenues to the household because they're small resellers. So we wanted to acknowledge that, the fact that women were caretakers of their households, and so that's how we designed the project. And also because the concern was we need to feed the households, and so the best person, I mean the person who does that traditionally in the household is the woman. And I think that it was really appreciated within the population by both male and female population. So that was the right call.
Excellent, thank you. Josh, over to you on different sources of data.
Yeah, sure. So the question was about why mobile phone and satellite data. And I think the answer is actually pretty simple, which is just that the main reason is that those are the two sources of data that are most representative in a lot of developing countries. So, satellite data is captured every day for every populated section of the Earth's surface. Mobile phone data, it's not 100% penetration, and that means that we have to think carefully about how to build in contingencies for households without mobile phones. But in many countries, including Togo, you see penetration rates at the household level of over 90%. Now, all that said, if there were another data source, if it's tax data, electricity data, Twitter data, it won't be, but you could imagine there might be some local social media website that's very popular, bank data, whatever. I think integrating those data sources into the targeting decision would be very helpful. It's just that mobile phone and satellite data are the most ubiquitous technologies right now.
Lovely. Mark?
Sure, and the question was on vulnerability, is that correct?
Exactly,
yeah.
yeah.
I mean, so I think this has been an interesting one for us. I mean, what has just been incredibly striking about COVID is the breadth of the impacts. And, you know, I mean, the numbers, I mean, what I was saying, I mean, in terms of the, in Kenya, where I am, you know, 50% of people reporting losing work, or the share of people reporting eating less and that type of thing. I mean, I think like where that has led us to with this type of approach is to recognize that in some cases, prior methods, well, one is in a situation like that, especially in low-income areas, essentially everyone is vulnerable. And second, that pre-existing mechanisms and measures of vulnerability may not sort of capture this this type of approach. So I think, I mean, what we've tried to do is think about what can we do that is quick and is acceptable and is sort of directional in terms of, and I think that's what's led us to aligning on specific geographic locations where poverty is concentrated, especially in urban areas, where the distinction between, you know, the difference in rent between an urban slum versus other areas are really big. There are challenges around what about the slums which are on sort of on the road reserve as opposed to the high concentration area, and that's something we are still kind of working on. But that's been one area of alignment with governments and as a way to bound it. Another is, I think, working with CBOs and partners. I mean, to some extent, CBOs are a filter of that already. You know, if you are a CBO who work with youth in youth groups around economic opportunities, most of those young people are not people with formal sector jobs because they wouldn't be going after that, and sort of similar with other types of things. And then I think beyond that, I mean, we've more seen the engagement around specific sub-demographics around the disabled and otherwise has been to try and promote inclusion. So we're not coming in here saying, oh, we think only we should be targeting the disabled or only targeting other things, but we do want to make sure that we're not excluding those groups. So proactively thinking about how we can do that along the way has been sort of an addition, in addition to sort of the focus on geographic saturation.
Brilliant, thank you, Mark. And lastly, just to Tina, in case there are any reflections on recipient perceptions and anything we're learning there.
Yeah, so I'm afraid I dropped off the audio, so I didn't hear your question clearly, but I think you asked about recipient perceptions of targeting approaches. So in terms of what kind of targeting approaches, big data or static census survey suites?
Any of these. So are there preferences? Have we heard anything about recipient preferences, about whether they think specific approaches might be more equitable or just or transparent or effective from just the recipient's viewpoint?
Okay, thank you, Radha. So at this point, I don't have any data to support a response to that specific question. What do recipients think of the different targeting approaches, whether it's a dynamic intake and registration, or whether it's a static census survey sweep where you go to households and provide them with a questionnaire, or whether you're using administrative sources or big data. I don't have any information to support that, but there are organizations such as Ground Truth that are looking at human-centered design, specifically in the light of the COVID-19 crisis, and I'm sure this is an area that you might want to also look into a lot of research.
Lovely. Okay, well, thank you. Again, thank you, a very warm thank you to all of our panelists for such a packed and insightful session and for sharing both their time and insights with us. Again, today's webinar was co-hosted by the Center for Effective global action and IPA, and we'll look forward to welcoming you to future webinars as well. So please stay tuned for more to come. But thank you to all of you for joining, and a particular thanks to our panelists for their insights today.
Thank you.